you can help them. And now it's like, hey, if we string a bunch of visits together, just can you imagine? Like, obviously, I would be the right one to help you with this. Tony, is that something that you ever recall your other therapist doing?
Jimmy, I sent you a link. Did you guys see that 2005 video that I shared?
Oh yeah, you were going full Gary V.
Oh, Dave, if you can pull it up.
Where is it?
I'll get it.
On Facebook. I thought I tagged you, but maybe not. My wife and I were going through old kid photos and kid videos, and we came across a couple folders of videos and pictures from like 2001, 2002, starting the physical therapy clinic. And I had no idea. I had completely forgot. Like, look at this. This is like I'm holding a camcorder.
Candid cam.
I'm not spotting the poor guy. I'm not guarding the poor guy. Even in 2005, this is back in Florida. I'm like focused on, I need to get the video. I don't know what I was going to do with it. This was, so far back. But this goes to like remind people, look, I've been doing this over 20 years, virtually the same stuff, Now, what this video did remind me of, I can't believe this could be a scene in my clinic today. Like, we have not innovated. I've still got people doing a sit to stand from a bench, maybe not on an AirX anymore, but I've got the AirX for other stuff. I'm wearing the same clothes. My geriatric seniors are exactly the same, except, a new generation of them. It's like a time warp. Like, other than my hair is darker and I have a little more of it and I'm thinner, but my clothes are baggier. It could be today.
I love it. Incredible.
I mean,
Tony, this almost looks like the gentleman with the joke book, like when he was younger.
Yeah. I can't even tell you how many people over the years have been replicas of themselves. It's just, it's just the same person keeps walking in my doors, but they have different names.
Paul's convinced you're a time traveler there, Tony.
Seriously.
I love it. See, this is just a reminder, like anyone that, like, sometimes, like when I had my grandfather-in-law video that now is up to like 156,000 views, which is still like decent, but not like, and then I go over to Tony's Instagram and I look at those reels and I look at the most viewed and it was like 2.3 million. I'm like, and I got excited from that video on my account, and it's like, you can't even compare it. Tony's been messing with these camcorders in his clinic in 2001, 2003, 2005, like before Gary V was on YouTube, before there was a YouTube.
Right. I'll bring up the post, but I shared this and I think both of you were excited to talk about it. Somebody anonymously posted in a large PT Facebook group that they said, I feel like I will have to spend between $5,000 and $8,000 to get some skills before I can get in my own cash practice. Have any of you done that? I rushed to the comments hoping, and I'll bring the post up. Maybe I was wrong, but from what I remember, I rushed to the comments hoping people would be like, you don't need to do that. Do not do that. You don't need it. Why? Do you just have 5 to 8K burning a hole in your pocket? If so, happy to take it off your hands, but you don't need to do that. And many of them were saying, yes, I did the same thing, but never saying I did the same thing and it burned me. I didn't need to do the same thing. What were your thoughts when I shared this? What would have been your reaction had you had been in that group when it was shared?
What group was it in? I remember the post.
Just just the big physical therapy group.
Go ahead, Dave.
So the first distinction would be what type of skills? That's the biggest question. Are we talking about clinical skills, which in general you should have? Maybe not as a new grad, because I think the first 3 years I was like, I had a big ego, and then I realized like how much I didn't know, but I thought I knew a ton, or I thought I knew everything in the first 1 or 2 years of being a DPT. I think there was a lot of like ego with that. But are we talking about clinical skills, or are we talking about business, marketing, sales, right?
So
in cash practice, you need marketing and sales. You need repetitions of being told no, which takes months, if not years. You need the marketing, you need the sales process of like, how am I going to overcome the insurance question? How are we going to navigate? What is the pricing? Like, how do we do all that? Like that, we're not even taught in school. And if you, like we talked with Tony a million times, if you didn't have a business before DPT school, you haven't gone through this. You haven't gone through rejection and starting a business from scratch and all that. So are we talking about clinical skills? If that's the case, I think you had enough with DPT, with the DPT. Or are we talking about business and marketing skills? If that's the case, yes, you probably do. I didn't, but you probably do need a coach that you need to spend $5 or $8K on for a course on how to do Facebook ads or Google ads or set up Google ads, or how to have a coach keep you accountable with reviewing your sales calls with patients and all, overcoming their objections, all that. So it depends on what skills we're talking about.
Right. I read this first as clinical skills, and then I read back and said, like, oh, to get my own cash practice, was hoping they were talking about skills that they weren't already taught, so they weren't paying for them twice. That is sort of the way I looked at it.
I commented, I asked, what skills are you looking for? And they replied like pelvic floor therapy, maybe manual therapy. And if you scroll through the comments, which you don't have to do now, but one of my previous teachers, Thomas Eberly, he and I don't agree on a lot of things. We agree on some things. He's working with Ron Miller down in Florida now. He's a cash PT, manual therapist, but he had suggested, yes, definitely, you can't start a cash-based therapy without better clinical skills. And of course, I knew the three of us would be like, heck no, the clinical skills, you just have to be not bad. You just have to be good enough. You need business skills, marketing skills, communication skills. You need to understand the consumer and what the consumer is actually buying in order to go into the cash-based world.
Yeah.
I do want to mention, though, I don't know if I was taught in the DPT program, or if we were, I don't know if it was, there was a big emphasis on it. So for like orthopedic or outpatient PT, I don't think I ever saw or remember, and I please correct me if you guys got it in your rotations or your first DPT job, your first outpatient job, about the pre and post tests, like to actually show the patient, like, okay, so you're feeling 7 out of 10 knee pain, and then we're going to do some interventions. We're going to do knee joint mobilizations. We're going to look at your hip. We're going to do this, that. We're going to do single leg stand, whatever. And then we're going to do these interventions. Then we're going to check your knee pain again with whatever, the squat or whatever movement. Okay. Oh, now it's a 5 out of 10. Okay. So now it feels better. And kind of showing the patient at the eval, like, hey, like what we just did, like, what we just did in like a treatment preview, not even the full visit, because we did the whole evaluation and everything. This is a treatment preview, and we just dropped your pain down from 7 out of 10 to 5 out of 10. That's a little bit of sales in a way. I think it's a great evaluation and treatment for the first visit, and the patient realizes that you can help them. And now it's like, hey, if we string a bunch of visits together, just can you imagine? Like, obviously, I would be the right one to help you with this. Tony, is that something that you ever recall your other therapists doing that you taught them, or they came out of school with that? Or Jimmy, I mean, is this something that you learned or what?
I know we did it in school. We were taught pre-test, post-test, measure the difference. In school, we were taught it as this is good clinical practice, but as a business owner, I knew this is a sales process. The only reason why I'm doing this is to be like, oh my gosh, you just improved 30% in 20 minutes. Like you said, Dave, imagine what we could do over 12 visits. It's totally a sales process. But in school, yes, we did learn it. We learned it as, this is what you document. This is how you do a good assessment. I don't think they even realized, because they were so stuck in academia, that no, you're selling. That's a sales process.
Paul, watching live, anyone watching or listening live, can you just comment wherever you're at? YouTube, LinkedIn, wherever this is being aired live. Can you comment if you learned it in school or at a rotation or did it in your first job? Because maybe Tony, maybe everyone's getting it. Maybe everyone's not. I don't know. Jimmy, do you remember that in your DPT program?
I don't think it was in the program. Again, it was a decade ago, so I don't want to say it. And of course, it'd be there. But I think this is two different things. Well, maybe three different things. Is it clinical? I guess. But really, if it's clinical, I think it's clinical psychology. It's showing someone, hey, look, you had this. We did this. It led to this. And then that is also sales. So I don't know if it's clinical. If it is, it's on the side of like patient buy-in, them seeing something and understanding something, us showing that movement and doing these movements will actually do better outcomes. So I think it's probably one, if not all three of those different things. But I don't think it was ever actually shown. I think that was a problem for me, is everything was shown like, oh, you got to rub the knee counterclockwise and not clockwise. Otherwise, who did you learn from? What book did you read? And to
you got to move the ultrasound one clockwise, not counterclockwise.
If you're north of the equator, you go clockwise, you dumbass. If you're south of the equator, you go counterclockwise. Otherwise, the magic gnomes don't provide the crystals to move in the right direction. So I think I went in thinking there was some magic and then realizing there wasn't, but then thinking I had to like sort of BS my way through things. And I was like, nah, I'm good. But I think showing someone after they do something that there's not a fear, not everything makes things worse. I think that's the magic.
Yeah. So Ben Galen commented live on LinkedIn. He said, never really taught for me. Paul commented live on YouTube. He said that we did have pre-post test as a point of discussion, more for knowing if we're on the right path versus a selling point. Both are true. Yeah.
Right. You know, it's funny going back to talking about the soft skills. So I think we talked about it last week. I had a returning patient. This patient has known me for 5-6 years, had a rotator cuff repair. Perfect example. Came into my clinic to schedule, didn't call to schedule, came to the clinic, was physically present. I said, hey, do you have 15 minutes? Let's do your eval right now. So had a rotator cuff repair 10 days ago in the sling, came from the orthopedic office, was driving home, said, hey, I'm going to stop into Tony's clinic and schedule an eval. I was like, you're here. You're not leaving unless we do an evaluation. Yeah. And so I'm like, hey, I'm going to rub your shoulder, make it feel a little better. She's like, no, you can't touch it. You can't touch it. I was like, what do you mean you can't touch it? You just had a rotator cuff repair. You're cleared to start therapy. Let's go. And she was like, no, you can't touch it. Anyway, needless to say, the point in this was, okay, I was able to diffuse, and this is somebody who knew me, but even knowing me was so scared that I was going to do something wrong to her shoulder. I got her to stay, rubbed her shoulder a little bit, loosened her up. She was like, oh, I do feel so much better. Fixed the sling. 15 minutes, we were done. Got the evaluation in the books and got her scheduled for once a week follow-up for the next 2 weeks until we can start doing more. I don't know, like that's not the kind of thing you learn in school, but that's the kind of thing that I think makes such a major impact. That's not the kind of thing that a typical employed therapist who's like, why the patient's not expecting to get eval now. The patient's fine booking the appointment and leaving and coming back. Like these are skills and I don't even want to call them talents, but something that if we could identify them early enough in the individual, we talked about hiring before, like these are the things that I'm looking for. And I don't even care. It's not the money. I don't care about the money. This is a very low reimbursing insurance plan. It does not matter. The money is not even you're not going to see it on a balance sheet, but it's the fact that the person was there. Why wouldn't I do the evaluation right now? Nobody else in the clinic needed me with them for the next 15 minutes. I could give them some peace of mind. I can calm her down. I can make her feel a little bit better. Like that is what I wanted to do. And if you're listening to this and you find somebody out there who's a younger person, eager to work and has that kind of perspective, you snatch them up. You pay them whatever they want to get paid and you put them on your team. Like those are the things we're looking for.
I totally believe that you can train that, Tony. You're almost saying like you think a non-owner. What I feel like you were kind of suggesting like a non-owner. It's hard for a non-owner to do that. If you put that in your playbook, I totally believe you can train that. My therapist that's been with us just for a little over like around 70 or 80 days, not like approaching his 90th day. He's doing 20 visits a week. He's making 113K, on pace for 113. Like the paycheck was enough to be 113K when annualized, right? And he's seeing 20 visits a week, right? So but he was selected, or he was interviewed and groomed to be doing all this type of stuff. And he's doing what you're talking about. Maybe not exactly the same, because it's some office visits and some home visits, but I think it's possible. It is possible to find these folks. And I don't think it's just the owner to do it. Of course, that is an owner move to do that. But I believe anyone watching or listening, like you absolutely could be finding folks, grooming them, training them. It's not going to be like you say it one time and they just do it, right? It's going to be like they need repetitions of like, hey, someone comes in, they have a knee replacement. Someone comes in, they got a rotator cuff repair. Someone comes in, they have a balance issue. Well, there's no time better than right now, right, Tony? Like, let's do it.
Yeah. What's the comment say?
Ben saying it's the difference between a restaurant that stays open until the last person leaves versus one that shuts the kitchen at 9 because they close at 10 and have to clean for an hour. It's a culture, not a something you can necessarily teach.
Yeah.
I agree. I agree with that last statement more. It's the culture, not a teaching.
Amen.
If you're part of the organization, if you empower someone to sort of be able to make decisions, you'll make better decisions, because you understand it's not the letter of the law, it's the spirit of what we're actually here to do. And I empower you to do that. I use the Zappos example all the time. They realized that customer service was a big bottleneck, and they said, listen, if it costs less than $500 to solve the problem, just solve the problem. Just understand, I might be like, why'd you just give that person a $500 gift card? It's like, I wanted to shut them up. Not a good answer. But it's like they got screwed. The system didn't work for them, so I just credit them back their shoes. Good use of that hall pass, or whatever they want to call it. So I agree with Ben. They're saying it is the culture, not something you can you can't write down an SOP for 4 billion possibilities. You can't foresee that. You can't write it down, and you wouldn't be able to find and say, well, what do we do in this situation? No. Do right, fear no man. Like, that's what they're trying to say, is like, understand that all these different options are within your purview. Pick the best one at the right time. Get close.
What other topics do we have?
I think we blew through all of them for today, but.
Well, Jimmy's coming to north of Columbus. We're going to connect.
75. A lot of these APTA chapters are turning 75 and doing celebration. So it's like a one-day conference, and then they're throwing a big old party.
So if you're traveling, you're going to be here Thursday, or are you traveling Thursday?
Traveling Thursday. I'll be there Thursday night.
Okay. Let's just do parting shots. Dave, what's on your mind? What do you got?
Well, I really like the comment from Ben about culture, and not necessarily a teaching thing for every aspect. So that's just on my mind right now, trying to recruit more therapists. And the main thing in terms of what's best for the client, what's best for the practice, what is that intersection? And of course, it doesn't matter what type of practice you're in, but if they stop in physically to say hello or book visits, yeah, why wouldn't you say, hey, why don't we just do a quick screen, a quick eval, get them going? For me, it's a great reminder. And that's something that you could always put more stuff into your playbooks around what to do when, but I love the reminder of, like, it's kind of like the culture, and you can't lay out every little scenario, but if it's kind of embedded in, like, the onboarding and the mentorship and the coaching and the training of therapists, then they typically would do the right thing, right? So, like, I want to get to the point where we have therapists in our office. I'm not there, but they would do what Tony did. A patient comes in, previous client, whatever, or like a spouse or a friend of a client, and they come in and they're like looking to, tour the office and look around or whatever. And can that therapist segue them into a quick consult or eval like that, and then get them going and lay out a plan of care and all that. So, like, that, again, just culture. And for me right now, recruiting and retaining the team.
Yeah.
Simple, not easy.
I think it's one of those things where, like, I'm a parent. I look at my kids, I'm like, did they come this way, or did I have any kind of influence on them? I think a lot of it is they came this way. And especially, I always say, like, if we had one of the kids first, we would think we were brilliant parents, and we'd write a book and we'd tell Dave, how to be a better dad. If we had a different kid first, we would be like, oh my gosh, Dave, what do I do? How do I become a better dad? Same with employees. I just think like you hire someone, you bring them on the team, they come with raw materials. Yes, some can be influenced. I think it's really a lot easier if they just come that way. If they're the person that's going to pick up the trash, not because it's their job, just because it's trash on the floor and I need to pick it up. I'll close with this quick story. I had a patient yesterday in the clinic. This patient has been a hairdresser in her 70s, still works, still active, wants to, get stronger. I had another patient who fell, second patient who fell, but didn't fall in my clinic, fell somewhere else. The hairdresser noticed he was bleeding. And so she goes over there, grabs tissues and starts like dabbing blood on his face. I would hire that woman in a second. I don't care how old she is. I don't care what her skill set is. Just the fact that she saw a problem. She saw this guy sitting in a chair, blood dripping down his face that he didn't realize. No concern for pathogens and infection. She just goes and grabs a tissue and starts dabbing his head. That's the person I would hire in a heartbeat. So, that's the job interview, not tell me about a challenging customer you work with. That's useless.
Yeah, show me, don't tell me. And that I think to go full circle, we started talking about marketing. You show that off, but from a customer or patient viewpoint, which is here's what I want or need, show me that. And then I understand that you're the person who can help me get that. Show beats tell.
Hey, it's Dave Kittle. Are you a healthcare business owner or physical therapy practice owner who is looking to figure out your succession plan or exit strategy? We might be able to help. And in fact, we may be interested in acquiring your practice. If you're interested, you can reach out to me. Shoot me an email at dave@conciergepainrelief.com. That's DAVE@CONCIERGE painrelief.com, or you can call me at any time, 646-781-8884.